Hello students, today we will be talking about parasympatholytics. Now parasympatholytics, that is a cholinergic blocking drugs. They will block the cholinergic receptors. Now cholinergic receptors, they have the neurotransmitter of the cholinergic system is acetylcholine. Now this the drugs will in therapeutic dosage block only the muscarinic actions of acetylcholine. So these include atropine and related alkaloids and synthetic or semi-synthetic atropine substitutes. The first one we will see is Belladonna Alkaloids. So the alkaloids present in the plants such as Atropa belladonna, Hyoscyamus niger and Datura includes atropine, hyoscyamin and scopolamine. Mechanism of action: atropine competitively antagonize acetylcholine at the muscarinic receptor. Now atropine has a greater affinity for muscarinic receptors than acetylcholine, but it lacks efficacy in initiating the activity. It will not interfere with the release of acetylcholine at the cholinergic nerve endings. That means the nicotinic action of acetylcholine at autonomic ganglia and the voluntary muscles will remain unchanged. The muscarinic blockade produced by atropine will be reversed by increasing concentration of acetylcholine. Now let us see what are the pharmacological actions of atropine, or in general Belladonna alkaloids. So you have Atropa belladonna, Hyoscyamus niger and Datura, and the active molecule is atropine, scopolamine and hyoscyamin. So they in general do what all pharmacological actions? Secretion. Belladonna alkaloid reduces secretion of exocrine glands. So say salivary glands. The atropine will block the watery secretion, which will be induced by parasympathetic stimulation. Then we have gastric secretion. Atropine can reduce volume and total acidity of the gastric secretion. Interdigestive secretion of acid in the stomach will be diminished or completely blocked. Atropine partially produces gastric secretion produced by caffeine, histamine and alcohol. It will reduce the secretion of mucin, an enzyme in the gastric juice, and also block the secretion increased by parasympathetic agents. Other secretions will be reduced, say atropine reduces secretion in the nose, pharynx, bronchi, and also reduces the secretion of sweat. It has little effect on pancreatic and intestinal secretions. So you can say in general the secretions are reduced. The smooth muscles, the tone and motility of GIT will be reduced. Now it completely abolishes the excessive motility of GIT and partial effective in blocking the effect of vagus nerve stimulation and does not interfere with normal peristalsis. Urinary tract. Atropine reduces normal as well as drug-induced urethral peristalsis. It reduces tone of bladder muscles and tend to produce the urinary retention. So what you can remember is urinary retention. And for bronchi, the bronchi are, the smooth muscles are relaxed. So whatever bronchospasm is produced by parasympathetic agent, so that will be relief. And but it is reducing the secretion is not recommended for the treatment of bronchial asthma. For the eyes, the effect is mydriasis. The ciliary muscles are paralyzed by atropine, which causes increase in the focal length. Thus individual can see things only at long distance. As the muscle of sphincter of iris are paralyzed, individual cannot constrict the pupil for viewing near object. So he suffers from photophobia. This is known as paralysis of accommodation or cycloplegia. Atropine produces both mydriasis and cycloplegia. Then we'll see cardiovascular system. What are the effects? Atropine in therapeutic dosage initially decrease the heart rate, and then it is followed by tachycardia. Arrhythmias are rare. Atropine abolishes the effect of parasympathetic effect on heart rate. In therapeutic dosage, it also counters the peripheral vasodilation and hypotension. Toxic dose of atropine produce cutaneous vasodilation, resulting in atropine flush and hypotension. Then we have CNS. Atropine in the therapeutic dosage stimulate the vagal nuclei, and this causes increase in the rate and depth of respiration. That means it antagonizes the respiratory depression. Now, what are the adverse effects of these drugs? Dryness of mouth, difficulty in swallowing, blurred vision, constipation, and retention of urine. Locally, atropine may show some allergic reactions like dermatitis. Now, in certain cases, there is intolerance which is reported and includes skin rash and dermatitis. Let us talk about the acute belladonna poisoning. Atropine has a wide margin of safety, but serious toxicity may occur, especially in children who are attracted to and ingest the berries or seeds of belladonna plants. The symptoms include are mainly because of the muscarinic blockade and central actions. So the muscarinic blockade will cause mydriasis, blurred vision, dry mouth, tachycardia, urinary retention, and dry skin or fever due to sweat inhibition. In the central effects, restlessness, hallucination, convulsions, coma, finally respiratory depression and failure. So what should be the treatment? The treatment should be instituted in the darkened room in order to relieve the photophobia. Gastric lavage should be performed to remove the drug. Then alkaloid inactivator such as universal antidote should be administered before and after the gastric lavage. Administration of anticholinesterase, for example, you can give physostigmine or pyridostigmine by IM or subcutaneously at intervals till dryness of the mouth is relieved, and catheterization for urinary retention. If depression is developed, then central stimulant can be used, but cautiously. If depression is severe, oxygen should be given with 5% carbon dioxide. Artificial respiration should be given to patient in case of severe respiratory depression and failure. Now, what are the therapeutic uses of these parasympatholytics? As we have seen, because they are reducing the tone of the GIT and the muscles, so we can use this property as for the antispasmodic effect in the treatment of gastrointestinal colic, renal colic, urgency of micturition, and to control nocturnal enuresis in children. Secondly, they are the effective therapy for treating the peptic ulcers, also for correcting the spasm of accommodation, that is with respect to the effect on the eye muscles, to produce mydriasis and cycloplegia. And one more important use is pre-anesthetic medication, because they are reducing all the secretion, salivation and respiratory tract secretion, which is required before anesthesia, so to reduce these secretions. And in addition, the alkaloids protect the heart from vagal inhibition. Hyoscine may also induce sedation. And then in the treatment of organophosphorus poisoning and in the treatment of Parkinsonism. And we have hyoscine, which is another important belladonna alkaloid. The peripheral actions are similar to that of atropine. Central actions are somewhat different. Initially, atropine stimulate and then depress CNS, and hyoscine is entirely depressant. Now, atropine in therapeutic concentration produce excitation, while with increasing concentration, central excitation is followed by depression, and then medullary paralysis. Iosine in therapeutic dosage cause drowsiness, amnesia, fatigue, and sleep. Both drugs in the moderate dosage may depress vestibular function to reduce motion sickness. In addition, dryness of mouth and sedative effects are useful to reduce the motion sickness.